Hi, my name is CJ Devgan, and welcome to Season 2 of Breaking Barriers. My goal for Season 2 is to discuss how digital transformation is redefining how care will be provided in the next 5, 10, and 20 years. I will be talking to leading minds in the healthcare sector and exploring how new disruptors are leveraging technologies such as artificial intelligence, population health, blockchain are reshaping the healthcare universe.
Hello and welcome back to another episode of Breaking Barriers. Today my guest is Zayna Khayat. She is a fellow futurist with her focus on creating a better future for our aging adults in their homes and communities. Hi Zayna, how are you doing?
I'm great. Hello. Thanks for having me.
Thank you very much for finding time for us on this fall Saturday. So before we dig deep into our topic of future of healthcare, may I ask you to share with our audience a brief background, and may I also request you to share a fun fact about yourself with our audience?
Okay. Brief background. So I'm Canadian. I'm born and raised in Canada in Windsor, Ontario, and my parents are immigrants from Lebanon. I did a PhD in biochemistry at the University of Toronto, focused on diabetes. And then I headed down to Bay Street, which is our big business street in Canada, and worked with the Boston Consulting Group for almost a decade, where I described my job as being a business doctor. So just solving messy problems in business. And that's kind of where I learned or really appreciated that I really want to spend my career solving intractable problems, wicked, complex, messy problems in healthcare. And so through a series of, different things, I ended up with the Mars Discovery District in Toronto, leading their health innovation platform. So really helping get innovation adopted at scale in complex health organizations and systems. I did a year in the Netherlands on a secondment, doing a bunch of fun stuff in 2017. And then I've kind of come back to Canada to lead this current role as the future strategist with St. Elizabeth Healthcare, or SE Health, which is a 110-year-old Canadian organization that brings health and care into people's homes wherever they live. Fun fact, I don't wear the color black, period.
Wonderful. Any reason why?
Something about the color gives me bad energy. So I don't own a single pair of black shoes. And I very, very rarely will have an item of black clothing in my closet.
Interesting. You always learn something new and interesting. I have so many black suits in my closet hanging, I don't know how I can go even a week without wearing something black.
I know.
Yeah, good. Wonderful. As we discuss, the focus of our show is on future of healthcare. We both have spoken on that subject and how our current healthcare system is still operating using 20th century tool. As we were discussing even last Thursday, I had to just get a med refill, and it took 2 hours out of my day just to get those refilled. So from your vantage point, what is the future of healthcare?
So first, I'm sorry it took you 2 hours to get a refill. It just baffles me. When we have colleagues here from the US, when we tell them, that you actually have to make an appointment with a doctor to get a refill for a script, they really can't believe it. They can't believe that that's happening. It's like bloodletting. But anyway, so, as a future strategist, my job is to scan and sense and mine signals and what's kind of going on around the world, because everyone's at different velocities of evolving to the future, as we're in the digital economy. And then I try to translate those signals to see what we can do differently here for our patients, families, communities, and of course, our own staff. And so I pretty much sum up the future of health into 6 shifts. And all of them are already happening. It's just they're uneven, they're at different paces, and very little of it for sure is happening in Canada. Which means I'm going to be, working for a very long time in this area. I'll just quickly go through these 6 shifts and we can unpack a few of them as you'd like.
Sure.
So a first shift is, from a timing of when we place care services from being reactive and really what we call sick care, waiting for the problem, the symptom, the illness, to proactive, preventative, and now soon predictive, where we design the care model around predicting when something will go wrong and intervening way earlier instead of waiting for things to go wrong. So that's a massive paradigm shift. The second shift is really how precise and personalized healthcare is and will be. So to date, it's actually pretty crude. It's quite analog. We still do paper prescriptions as an example. And it's really a one size fits all, like a segment of one. There's no industry that treats its customer as one segment. You go out of business. So all that is shifting to, from a segment of one to an N of one, precise, personalized, and what we call an intelligence-based healthcare system. The third shift is the location or the channel or the modality through which people will get services. And right now it's been largely institution-centered. You have to go to the clinic, to the hospital, to the pharmacist. And that will all change, to being really decentralized and really this model of care anywhere, which implies then, digital and physical experiences will just be seamless. We won't talk about digital health or mobile health or electronic health. It's just going to be healthcare, like every other sector in society. The fourth shift is the duration of, when services are experienced, how long they're used for or accessed. It's been extremely episodic, intermittent, extremely siloed, because we've effectively time-shared the expertise. The 15-minute visit, the one MRI you're allowed to get, because we have to time-share all of that capital and labor. And as technology kind of democratizes things, things will be way more continuous, seamless, and team-based. We organize medicine around diseases and body parts, and that's not what humans are. And so, it will start to reflect like the holistic nature of humans and people, instead of optimizing around the needs and the convenience and the cost structures of the people serving those humans. The fifth shift is a big power shift in terms of how decisions will be made around your health. So the power shifting from providers, so health professionals, health clinics, institutions, who we've really outsourced our agency to until now. And, as you and I get all the information and get a lot more empowered to be the CEO of our own health, we will shift to what I call people-powered healthcare, where at a minimum, we will be a partner in our own care, and more people will basically take it all into their own hands. And your provider will be asking you to subscribe into your care circle, not the other way around. And then finally, the last big shift is really what I call a business model shift, where we go from measuring as our kind of KPIs, activities, inputs, costs, paying by the pill, paying by the visit, paying by fee for service, to a business model shift to paying for the result. So kind of fee for health. We haven't had a business model change in healthcare in over 150 years. I think we're the only industry left where the business model has kept pace with organizational kind of legacy, and those days are over. So that's it. 6 big shifts, a lot of change coming.
Lot of change. So absolutely. I'm glad that we ended on the number 6, because that is where I think an important shift are to start for our Canadian healthcare. Because if you talked about US colleagues, and in US, we are already starting to see this shift from value-based, fee-based care system to value-based care system. A lot of population health dialogues are happening, mostly because of the way health system is, like Kaiser, for example, or other big health systems. They are now both the providers of care as well as insurer of managing the fee structures and everything else. So it is in their best benefit incentive to make sure that we start to move from fee-based system to value-based system. And it is always a very, very challenging from my perspective to understand, given Canada is a single-payer environment, why these shifts are taking so long. But I will ask you just to give a couple of minutes, and then I want to actually focus on more, because this is something for a politician to figure out why we're not moving to that. But from your perspective, why do you think we have not made that shift?
Yeah, on paper, the Canadian health systems, we don't have one, we have 14 or 15 by province or state.
Correct.
They in theory should be designed this way because we don't have any middle layers, right? We have the insurance and the delivery is all combined.
Correct.
But no, we're very slow. I mean, at the end of the day, if I had to narrow down one major reason why we are behind in modernizing healthcare, it's all mindset. That's it. And this Canadian mindset, has done amazing things for us of being so conservative and risk. We're generally risk averse in everything, but in healthcare, we're not just risk averse, we're risk intolerant. So we don't try to manage risk, we try to exclude risk. But, that's been great. So in the financial crisis, for example, Canada did great. Not even, a problem because our banks would never, ever allow our regulatory system, the kind of financial products to proliferate like they did in the US, as an example. However, when it comes to healthcare, then, it's just permeated the culture, the mindset, the kind of talent who get recruited up into the ranks of decision making. And it is very difficult to get that out of a system. And that's exactly why there's disruption theory. That's exactly what happens because, it's very difficult to change your business model from within the very business model you're in. It's almost impossible. So at the end of the day, it's mindset. And then, of course, under that, are about 20 other barriers.
Yeah, I hear you loud and clear. I think what has served so well for us, even though, yes, I agree with you, they are each province, but I consider that a form of a government and how those taxes get distributed between federal and province on health. So that is why I club them together. But given our aging population, and I was reading somewhere that 3 Canadians are supporting 1 senior Canadian, and that number is only going to go smaller. The denominator is just shrinking. I think it was 4 in 90s and now somewhere in that 3 ballpark. And we are living longer. We are aging. So if we do not change the way it is, then the future of healthcare in Canada will have to see much bigger disruptions if we don't change and make those smaller changes now. But that said, I want to spend more time on each of those 6 shifts and more focus. Given we have a 30-minute window, I want to spend some more time on the key accelerators that will change us from timing where we are waiting for someone to get sick to more proactive, predictive kind of care.
So I think there's 2, what I'm seeing from the places where either an entire health system or at least one kind of a disease treatment pathway is shifting to a predictive model instead of a reactive model is 2 drivers. So in the one context, in my example will be Khayat, the health system in Israel, where, this is a region that has about 4.5 million people. They've had all the data from, what I call womb to tomb, from birth to end of life of this population for 20 years. They're now actively mining, scraping, and looking at that data with, some partnerships with some pretty heavy powered data companies to predict with accuracy, who is going to get chronic kidney disease, who's going to get diabetes, who's going to have this or that. And then they're deploying their resources to stop that from happening. And those are the very resources that would have been used when the person got kidney disease, So that's actually happening now. And every year their kind of CEO and their chief information officer shares, the next illness that they've done a predictive model on that they're, changing. So that's one. That's at a system level. That's just going to get more and more as every health system just starts to digitize the data. Because the reason AI is all over the headlines in healthcare, it's not like all of a sudden. I mean, Kaiser Permanente has had an AI and machine learning team for over 20 years. This is not new. What's new is the volume of data that can now feed into the machines and then the processing power. Like that's what's new. So that's one. The other one, which gets me very excited, does not start with a big health system, like Khayat, that chooses to create the future, and very few behave like Khayat. It's more bottom up, where a startup that has wicked data capabilities can crawl and mine any types of data, biomarker data that is not clinically generated. Your voice, your how much you walk, or whatever, your language, how you express yourself on Facebook and chat and all this stuff. And then they can predict who's going to have a schizophrenic episode, who's going to have a hypoglycemic episode, who's going to try to commit suicide, who's going to get Alzheimer's. So we're seeing papers published regularly of these new predictalytic type care models. And I think those are going to be very interesting because they're not constrained by analog objects and activities such as the doctor visit. You don't need that clinical data anymore because you can scrape the data from many other sources. So those are the kinds of examples that we're seeing pop up.
Interesting. If I'm looking at again, most of my show is from Canadian lens. The first option where we talked about womb to tomb means we have to collect a lot of data. And that goes back to our current mechanism where we still don't have a lot of data collected on Canadians. And even if it is collected, it is living in silo at the various Mount Sinai may have some data, and Brampton Civic may have some data, and my PCP may have some data.
Yeah.
All that is not consolidated into a single data source. So where we can do any kind of predictive.
But it is, right? It's just we don't have, again, top down, it's very difficult to get these custodians that do sit on some pretty impressive data. Let's be clear. It's pretty good, right? ICES, this is the Institute for Clinical and Evaluative Sciences, is a research institute that has all of the data for Ontario, everything. Of everybody, forever. And all of your everyday data of your doctor visits and your hospital visits and your home care visits, your drugs, it is all connected, at least in Ontario. If a clinician wanted to, they could get everything in, a few clicks of a button. It's just that nobody is taking the fortitude to mine it in these ways. That's the difference. So that data, though, is locked in the system. I agree. So for an everyday problem solver who wanted to maybe mine that data and interrogate that data and maybe come up with some new insights, we are locked out. That's the difference, because it's not open to a broader set of problem solvers. It's pretty much only open to the billing people who pay the bills and research scientists who study the data, produce papers about the data, and then ultimately it informs policy. That's where it's stuck in Ontario.
So that brings an interesting point as well in terms of mining this data and why Western Hemisphere has been at the front foot for majority of last 200 to 300 years is because of the capitalism, where we provide incentive to private organizations to go and build these models and then make profit on it. Given our healthcare data is locked down and only available to builders and to some limited researchers, how do we allow that mining? Do we expect government agencies to mine this data? And we know how government
my Khayat example, that's a state health system. They just are progressive, much like Estonia is, right? So yeah, you do expect them to, but most won't. Certainly none in Canada, not that I've seen. So instead, though, and then that's a bit of my message a lot, and I'm really parroting it from Dr. Eric Topol's book, Deep Medicine. And if you read it, his message is actually it probably doesn't matter if you get your act together to find ways, on your own or whether you choose to partner with the private sector who will do it better, faster, and cheaper than you as a government. It doesn't matter, because most of the data that will now inform these algorithms is going to come, what I call extracellular to the formal healthcare system. So he now predicts or estimates about 90% of all health data is not generated in those data prisons we just talked about. It's generated by you and me outside of clinic.
Yes.
And it's generated by things that people never used to call clinical data. Your postal code, your poverty, all these things are accurate predictors.
Yes.
So what's happening is these new private enterprises are creating algorithms off of that data. They don't need to have a 1-year data, process to do a stupid data sharing agreement with hospital X, where the only people who get value out of that process are lawyers, to, now they can just crawl your texts and predict schizophrenia, or depression or a COPD episode or whatever. And so there's a great example of a great Canadian company that's doing just that. Winterlight Labs, is mining and crawling voice, tone, speed, language, a whole bunch of things. And they can predict who will get Alzheimer's very, very, very much before symptoms. And that data costs kind of nothing to get, right? So that gets me excited. So the point is, the new solutions, I think, are going to end run the formal healthcare system, and they're going to be generated outside of it. They're going to be better, faster, cheaper, intuitive, and they're going to help you and I create health. And we will find ways to pay for that. And I don't think our formal health system is going to catch up.
And that was exactly the question I was going to get to, is how are they going to monetize this thing? Like, who will pay for that? I'm talking about Alzheimer, if I want to know about my health and my behaviors, would I be paying for it, or my OHIP will cover?
Yeah, there's a whole bunch of monetization models. So in some cases, if, it's so clear that there's a value add of, let's say, an early prediction of, a very, very bad disease, the payer, whoever's paying, whether that's a public funded insurance or a Kaiser or United, they would be very much willing to pay for that on your behalf, because it's going to prevent a whole bunch of downstream things. So there's a bunch of those business models out there now. Another business model is like the freemium model, or it's free. So, an example of that is, a whole genome scan. Right now, I think if a Canadian wanted to do one through like a patient's like me or Ancestry, I don't know, maybe it's $200. Well, Nebula Genomics is now offering that test for free because they're monetizing your data, and you're letting them if you want to. Because the business model they can create is on your genomic data, which they can resell to research or something like that. So there's that model. There's a whole bunch of ways to make this work. And so I don't want the listeners to take an impression that this is going to only be for the rich who are going to pay for this and then bypass the formal system and have some advantage. Not really, because the first users to try these new ways to manage your health out, it's going to be clunky at first. It's going to be a bit of a learning curve. And then, once it's figured out, it's going to be very, very cheap, if not free.
I completely agree with you. And I believe that we have to have some kind of a hybrid mechanism. In US, it is very straightforward because insurance companies are for profit organizations, and they look at total cost of care being provided, and they can make that business case. Our politicians, given they are elected for 3 to 4 year terms, sometimes they cannot realize those initial investments because there is some curve to start to recognize the benefits from these investments, are not as visionary as private enterprises are. And that's where I see the challenge in the Canadian landscape. And definitely the horizon that we have is beautiful. I do see all these shifts happening. I know Canada is on, as you mentioned before, we are ultra conservative when it comes to healthcare. We don't want it to be changed because of fear or whatever that may be. But overall, the world population reaching that 10 billion mark in next decade or so, we need to have a mechanism where we can provide care to individuals who are not as fortunate as we are, where we have all these things. So I think the shift that you talked about, the modality where care is not provided in big institutes, but anywhere the patient is, will be a key factor. However, we are running out of time on this episode, but there's so much we can talk about. I'm very interested in talking about modality as well as the duration, those two shifts we haven't talked about. Precision medicine is a beast in itself right now. Mm-hmm. That is for us the richest because it is so expensive. But I am, like you said, over time that will become a norm, and again, how long we need to wait and watch.
Well, you'll just have to invite me back.
I am very, very open to that. We definitely need to have more conversation on these three topics. I want to thank you for your time and sharing your vision and opinions on the future of healthcare. Any last parting words?
No, I'll just say, two things. One is for anyone who's in this space or, of course, wants to enter this space is, really I encourage people to focus their energy on creating the future instead of protecting the past. It's just too easy to protect the past. And as you've said, we don't have time for that. And then, of course, happy Diwali to you and your family. It should be a fun month for you.
Thank you, Zayna. I appreciate that. Have a wonderful rest of the weekend, and I look forward to speaking with you again soon.
Okay, bye-bye.
Thank you. Bye.
That is all for today. Thank you for listening. If you are a healthcare executive and grappling with challenges to transform your organization, contact me and let's talk. If you like our show, please subscribe, leave a rating, and a review for us on iTunes. Ciao, and have a productive week.